My name is Marie Kiernan, and I am a Nursing and Midwifery Innovation Fellow with the Spark Innovation Programme. And as part of Spark Connect Ask Innovator, I'm happy to introduce you to Isabelle Curran.
Hi, I'm Isabelle Curran, and I am a product designer who has just graduated from the University of Limerick Product Design and Technology course, and I am from Kerry, Ireland.
Welcome, Isabelle. So tell me, can you describe your innovation in one sentence?
So my innovation is Aletheia. It's a softer, safer, more supportive way to insert an IUD. Describe your innovation in one sentence, Anne-Marie.
So my innovation is affordable, inclusive, 360-degree virtual reality on your mobile phone for the chronic pain patient in the community. It's a very long sentence. So Isabelle, tell me, what was your biggest challenge that you've faced so far?
So I definitely think biggest challenge is innovating in the medical space, and I found people kind of being stuck in their ways and trying to get people to look at more change, definitely in the medical space, and creating more user-friendly solutions has been my biggest challenge. And knowing that not everyone is going to be like 100% supportive with a change, especially in women's health, because I'm innovating in that space. Um, so yeah, kind of getting people to be open to change. But then one conversation might be all for change. So definitely that has been the biggest challenge for me personally, to not take everything personal when people don't want change. So yeah, that's my biggest challenge. How about you, Anne-Marie? What is your biggest challenge you've faced so far?
In part, very similar to you. It's kind of like the recognizing the importance of meeting people where they're at. Like my project being a digital project is so different. And because I think with healthcare in recent years, like we had the cyber attack, so people are a bit more apprehensive with things that are digital or electronic or AI based. So for me, it was one trying to kind of meet people where they're at with their digital literacy piece, meeting staff where they're at with what they're able to take on or willing to take on. But then also like with digital, it's the red tape that goes with trying to get a digital innovation in place, like the things you need to do beforehand, like the different documentation, the different assessments, and then equally after, what are the documentation pieces and the education pieces? Because it can be really difficult to kind of address um people's apprehension to taking things on. But I find when you get one or two people on board, it kind of starts to snowball. I'd say you found that very similar, Isabel. It getting that one or two people who are interested in the field to take it on board and to be an advocate or kind of a champion for you in the space.
Yeah, yeah, no, for sure. Definitely connecting with people in women's health and in the space, and people who are looking for change and innovation was definitely something that drove my project further. And definitely getting in and observing patients in the space was also a big challenge for me. And once I got in with that, then that's kind of the snowball effect of getting things running. And
Mm,
obviously back to connections again, like yourself.
yeah. But like I think I loved your project because it was kind of speaking from the voice of someone who was in that space, had that experience, and kind of being an advocate for the female patient. Because like femtech, it's just such an important space, because like I know people are more aware of it now, but it has been such a neglected space. But looking at the value of the female experience of these procedures and making it easier and not just making it something that they have to just put up with. It's recognizing the importance of comfort and of feeling secure and feeling less vulnerable. So I loved your project when I saw it for that reason, that it really took on the voice of the patient rather than the the company that created it. You gave the
Yeah.
voice to the patient through your design, which was fantastic.
Yeah, thank you so much. That's definitely where I kind of began with the project, is speaking to people who had gone through the insertion process of IUDs. Before I even spoke to any clinicians, I really wanted it to be very user centered and bridging the gap between patient and clinician.
Mhm.
So I really found that I had so many women coming to me saying, "Oh, I've had an IUD. I want to tell you my story," and just sitting down, listening to many horror stories and many good experiences. I think really what drove this project from the beginning, because we go through research and then go into ideation. So yeah, definitely I wanted my project to be very user-centered and speaking for the woman who had gone through it. So I'm so happy that you say that.
So now taking it to a different field, if you had unlimited resources, what would you do next?
I think my next stage of the project, because I'm currently working on it at the moment, developing it further, I think definitely getting other people involved because it's such a big project. And I'm currently going into observations of many different women's health procedures, looking how to innovate in each space. So I think definitely getting people on board, um, definitely more healthcare providers on board, like gynecologists, consultants, women's health GPs to innovate alongside of me, would be great. And then also, I would really like to get the prototype up and running and tested, obviously on models first, and getting the materials right for that. So if I had unlimited resources, I definitely look at expanding my team, a team of designers, clinicians, and looking at building the prototype to one step further because I've done it so far just on myself with the own resources I can get around me. So yeah, how about you? What would you do if you had unlimited resources?
Oh, if I had unlimited resources, obviously I'd love to scale my project. For me to be kind of, if I had unlimited resources, be looking at what are the problem spaces within my own region and my own area that need to be addressed and having the team in place to try and address them and to create a solution or to lead people into creating the solution themselves. So it's
Yeah.
very, yeah, it's very process kind of orientated to try and empower and create the innovative ecosystem.
Yeah, no, for sure, definitely. Even like having more people involved in looking at innovation and observing, I think is an amazing way to innovate in this space,
Mm.
um, in your space and in mine, to get things going.
So like what, like coming from your own experience and like your own path, like what advice would you give to other healthcare innovators?
I think I would give the advice that definitely listen to the patient and bring the patient first, patient centered design into the healthcare innovation process. But also listen to clinician and try bridge the gap between the two. I think there's so much healthcare that is quite clinician focused. Sorry, healthcare innovations that are quite clinician focused. So I think my main piece of advice was listen to the patient first solution and develop on that. And also that the whole process, throughout my design journey, I was constantly going back and forth with clinician and with the patient that had gone through the IUD insertion process. So really that you are developing it with them in mind along every step of the way and not for them, but with them. How about you? What advice would you give to any other healthcare
Um,
innovators?
I think probably be curious, number one, because I think being curious, you don't accept things at face value and you tend to delve deeper and deeper into the problem or the solution to make sure it's the right solution. I think one thing I've carried with me throughout all of my journey in innovation is that um, every success was once a failure where someone said, let's just try once more. That it's not just to give up easily, that there's always a way around. It's just you haven't met the right person or the right solution or the right opportunity at that time. Is if you're confident in your idea, then it's important to keep going with it. I think that probably my best piece of advice. So Isabel, thank you so, so much for chatting with me today and for being part of Spark Connect and Ask the Innovator. You never know who you could inspire. And we look forward to seeing you in the future in your project. So thanks so much.
Thank you so much, Anne-Marie, and it was great to hear all about your project as well, and best of luck with it.